Hiyo guys, my name is Furosamai, but some people also call me Lasix. Do you know what part of the drug class I'm in? Well, I'll tell you. I'm a part of the loop diuretic drug class. What's that you say? What does a loop diuretic do? Well, I work in a loop thinly and I prevent excess reabsorption of sodium and chloride, and I also cause the kidney to diurese a lot. He's not lying, guys. He makes me excrete a lot of fluid. You heard it from Kidney himself. I'm sorry, what was that you said? What am I used for exactly? Well, thanks for asking. I'm happy to tell you. Prescribe me to get rid of excess fluid such as edema in your ankles, heart, lungs, or ascites, which is edema in your stomach. I'm used to get rid of all of that. Doctors also use me for high blood pressure because I decrease the volume in the intravascular space. Also, I'm used off-label to correct hypercalcemia, so I do a lot of things for your body. But there are also some things you should be aware of that I can cause. But I think my friend Mr. Hart can explain these effects better to you.
Oh, thank you, Mr. Lasix. Well, hey guys, my name is Mr. Hart. So some of the things Mr. Lasix can cause is hypotension, hypokalemia, dehydration, and also nighttime urination if you take him too late at night. So guys, it's important that your healthcare provider educates you on monitoring your blood pressure frequently and also increasing your potassium intake because Lasix is a potassium wasting diuretic.
Well, thank you, Mr. Hart. A few things that Mr. Hart left out that I can cause is hyperglycemia and hypomagnesium. Signs and symptoms of hyperglycemia will be hot and dry, and signs and symptoms of hypomagnesium is tremors, weakness, and muscle twitching. So be sure to educate your patient about these signs and symptoms. Now I'm going to let my friend Mr. Kidney educate you on the contraindications and precautions of taking me, Mr. Lasix.
Hey guys, I'm Mr. Kidney. So some things you should be aware of when you're giving Mr. Lasix to me is if I'm a urea, which is unable to produce urine or put out urine, you wouldn't give Mr. Lasix to me because I can't already do my own job. If I didn't have legs, you wouldn't try to make me walk, would you? Great answer. Next thing, guys, you should be aware of before giving Mr. Lasix if your patients have cardiovascular disease, diabetes, electrolytes deficiencies, and also if they already have hypotension because Mr. Lasix can further complicate these problems. So it's always important to consult a healthcare provider or notify your healthcare provider if you notice any of these contraindications. So always be safe when you're giving Lasix, guys.
Thanks, Mr. Kidney, for that lesson. So let's talk about something super duper important, guys. Patient educations. So what would you educate your patient on when they're taking me, Mr. Lasix? That's right, guys. Frequently monitoring your blood pressure because I can cause hypotension. Yes, guys. Frequently monitoring your weight gain or weight loss to determine my effectiveness. Y'all are so smart. Yes, guys. Educating my patient on increasing their potassium intakes with green leafy vegetables or bananas because I'm a what? Potassium wasting diuretic. And guys, don't forget to educate your patients on signs and symptoms of hyperglycemia because I can cause that too. So guys, it's been fun. Thanks for hanging with me, Mr. Lasix, and my friends Mr. Kidney and Mr. Hart. Be a safe nurse, guys, and always verify your patient.